Diane Egbers, CEO of Leadership Acceleration, and we are thrilled as an ongoing partner of OHA to be with you today. Our focus is going to be on cross-cultural inclusion and competence, and looking forward to taking this journey with you. And the way we always like to start is with that thought that the greatest journey is the journey within. And we'll spend some time helping you to assess your cultural intelligence and what that means individually, looking at your organization as it relates to the cultural intelligence learning pathway, and learning about some real-world examples from other organizations. So we welcome your insights, and we'll have a Q&A at the end to answer any questions you might have. So our healthcare experience includes many different health systems. Here are a few that you would recognize that are in Ohio. And Dr. David Livermore, who's written more than 10 books on the concept of cultural intelligence, is a partner of ours. And what he says is there's a little hope that you can develop skills to work effectively cross-culturally if you don't first have an awareness of how culture shapes your own thinking and behavior. And that relates to that journey that we're all on to become more culturally competent. So CQ, Cultural Intelligence Awareness, is all about embracing our own stories on a pathway to embrace those of others. So I thought it's most appropriate to start with a story. So I had gotten a professional certification and was traveling from Chicago. What happened is a flight got canceled at 9 p.m. and we just decided to, partner and I, who were from this area, had met during a certification, decided to drive back to Cincinnati from Chicago. So it was 9 o'clock at night, and we thought we'd jump in the car and make it home by 4 a.m. or so. And we got as far as Indianapolis, and a cop car comes up behind us and pulls us over. And I immediately reach into the back seat for my briefcase to get my wallet. And my colleague grabs my arm and starts screaming at me, "Put your hands on the wheel, put your hands on the wheel," and she's so upset. And the officer comes up to the window, says, "Hey ma'am, your lights are out." And I had been used to having auto on my car, and so just didn't even think when we were leaving the airport on a snowy February night to turn my lights on. And so was very generous, said, "Now be careful." And so as the policeman walks away, I look at my colleague who's African American and I said, "Oh my gosh, please tell me your story." And she proceeds to tell me for the next 2 hours from Indianapolis to Cincinnati, the 4 times she had been pulled over. 3 of those times she was a senior executive for Procter & Gamble, sitting in her car, waiting on appointments, and had negative experiences with police officers, had been asked to get out of her car, had been frisked, had all kinds of experiences that I couldn't relate to. I had been pulled over in my lifetime 8, 10 times. Every one of those times had been not a pleasant experience, but had been an experience that, I'd give them my license. Sometimes I got out of tickets and sometimes I got tickets, but I didn't have that fear that she, that terror and fear I saw in her face and heard in her voice. And it just opened my eyes in a way that they wouldn't be opened had I not said, "Please, tell me your story." And that's what we're looking for when we think of cultural intelligence. We're looking at how can I embrace my story to the degree that I then am open and curious and listening and willing to hear the stories of others. And when I hear them, how can that increase my compassion and understanding of her journey is very different than mine. We're both on a journey. Hers is just different than mine. Diversity and inclusion, as you may know, is the #1 stated issue for healthcare systems in Southwest Ohio. And we know that because we all experience it, as it relates to feedback we get from patients, our healthcare staff, and the experiences we have as leadership. As we become a more and more diverse community and diverse society, it is a compelling need, and I know that you agree. What is cultural intelligence? It is really that capability to function effectively across various cultural contexts, be it national, ethnic, organizational, gender, generational, racial, all of those cross-cultural contexts. It's that ability we each have to function effectively no matter the situation that we're in. And then when we think about how important that is, particularly in healthcare, we have interactions with people now from all over the world. We have different immigrants coming to our great state of Ohio from many different places around the earth, as well as the issues that we know are here and present with us with regard to all that's occurred in our communities and our culture in the last year or more. So let me start with this question. Who would you choose? If you're on a sinking ship and you could only save one person, would you choose your child, your spouse, or your mother? And thank goodness this is a rhetorical question and not something that you have to do, but something that we would just ask of you. And so you can imagine when I was certified, I did this in a group of leaders worldwide, and everybody from the US and Canada and Australia, we all ended up in the space probably similar to what you would select, is we would save our child. However, the individuals in our group who were from the Middle East, from Asia, from different places around the world, they chose their mother. And they have incredible reverence for their mother. And when asked why, they said, you can always have more children. You only have one set of parents. And so really interesting when we think about just how fundamentally different our value systems are, and then culturally how those have the potential to clash. And cultural intelligence is navigating our way through those differences to create that vital connection and to be inclusive one-to-one, in groups, and especially as healthcare organizations. So the data then, and I don't know about you, but I, working in healthcare, love data that supports anything of value. And so what we know now is 48 of 100 of the largest cities in the United States have minority populations that are the majority of their population. 90% of all population growth in this country by 2050 will be from people of color. And so we are going to continue to become dramatically more diverse in a rapid fashion. 70% of international ventures fail due to cultural differences. We know that and experience that in all of our work. As we think about information from The Economist, 90% of leading executives in 68 countries said that they find effective cross-cultural personnel is a top management challenge. And we know that leaders being prepared to navigate conflicts that arise, situations that occur of a cross-cultural nature is a vital competence that we as leaders need to have, as well as our staff as we think about the patient experience that I know you care so much about. Everyone can improve their cultural intelligence because it sits on a development foundation, and we'll talk more about that. So, from working across borders to bridging cultures at home, we have incredible opportunity. So the reason we partner with a cultural intelligence organization around cultural values and the CQ assessment and report is it is the first comprehensive assessment of its kind that gives you as a health system a baseline measure, provides intact executive team, leadership team development, as well as development for all staff that your team can be certified in, that is a developmental framework that encourages and nurtures the development of cultural intelligence across your entire system. And so specifically, cultural values are the 10 culture clusters that exist around the world, and knowledge that your team can gain, and a quick read and reference for cultural values. The CQ report then reports on the 4 development aspects of cultural intelligence and gives you as an entity as well as your team a baseline for that understanding. So as we think about then the defining points of cultural intelligence is it's a coherent framework, has academic validity, more than 100 scholarly articles, predicts performance, and it's a developmental approach. So it's a journey that we're on. You know, we are all a product of our cultural heritage, our background, our ethnicity, our experiences, and we're each on this journey at a little different place. And so the reason a development approach and framework works so well is that it meets each person uniquely where they are, encourages them to take the journey within and embrace their own story, and then to really understand then CQ drive as we think about the 4 capabilities is really the degree to which we're curious. Are we curious about those people that are different from us, societies that are different from us, cultures that are different from our own, and how are we leveraging that curiosity to seek new experiences and new understanding? Our CQ knowledge then is about specifically the deeper kinds of things that we need to grow and learn more about. For some of us, it's socioeconomic, some of us it's racial, gender, generational, so many experiences we have. And are we seeking knowledge where we're least comfortable? And how are we going about reading, learning, experiencing the different personalities, people, and cultures that we interact with so that we can be more effective working in a health system today where we have such diversity that if we embrace it can really be leveraged for greater teamwork and innovation. So we think about strategy. CQ strategy is the degree to which we plan for interactions that we sometimes in the past may have overlooked. That opportunity to make sure that our information desk is accessible to all types of people, and regardless of what their needs are, that we're thinking about things as small as what happens when somebody comes in and approaches our information desk to what is that patient's experience that doesn't speak English, and everything in between. Do we have strategies as a healthcare system? And then the CQ action is in one-to-one interactions every day. How connected, non-judging, inclusive, and expressive are we to really match that person we're interacting with? And so all of those things are contemplated as we think about helping an individual on their journey to creating cultural intelligence. Okay. So when we think about all of this, I always like to start with a simple experience. And I'm going to ask each of you to think about, in your family, what did your parents do when you got a cold when you were a kid versus what you do now when you get a cold or your family members get a cold? And so in our family, we were Irish Catholic by background, and there were 6 of us. And so when you got a cold, you got a shot of whiskey and you were sent to bed. And what happened in our family is that was the way in which you were given cough medicine, and you woke up the next morning and boy, did you feel better. But it just, you think about, oh my, and everybody typically has very different cultural experiences around how even a cold is treated. And that just gives you insight into how fundamentally learning and experiencing everybody's story and where they come from is a fascinating journey. You know, things as simple and profound as what happened when you had a cold, really interesting discussion. And as I've had the chance to talk to more than, probably 1,000 people now, having facilitated this, there's always a new one. There's always something with every group, new and different, that comes up that their family had learned to do when they had a cold. And so reason we share that is really just to get how foundational this journey is. You know, it comes from the roots of all of our experiences, our background, our culture, history, and embracing all of that means as we take the CQ quiz at a high level, we really want to, with CQ Drive, we want to say, what are the ways in our current healthcare system that I could be more curious about those that I don't know or experience very much? And so I know one of the healthcare systems we serve has a large new Somalian population. Another has a very large emerging population that is from Honduras. You know, as we think about those ways to be curious, what are some of those significant ways that would affect you, your health system, if you were more curious about those things? As we think about CQ knowledge, knowledge is about where do I need deeper insight? Maybe for you, it's gender identity kinds of things. Maybe things related to specifically generational. You know, what do I know about Gen Z, the newest generation, graduating this year? How are they alike millennials and different? You know, we've been studying that for a year and a half. Fascinating things we're learning about the first new digital generation and what that's going to mean in the workplace. They literally, by the way, as a generation, don't see boundaries. You know, everything is connected because their entire experience has been on the internet. And so getting back to cultural knowledge then, what is one area that you could really deepen your knowledge in? So we think about CQ strategy. The question here really is, how can I be more planful to be inclusive? Sometimes it's the little things, not the big things. Sometimes it's maybe there are members of your team that celebrate different holidays. How can you be more inclusive with regard to that? Maybe there are folks that are new to the team that have very different life experiences that they could just, if they're willing, share some of their story, some of what happened for them before they came into your organization. So when we think about being planful, sometimes it really is the big things like hiring practices and creating opportunities to be more effective with diverse leaders at the senior leadership level. There are significant system kind of planful type things, as well as the little things that relate to how inclusive and connected staff members and leaders, people feel on rounds, how inclusive people feel. What are those strategies? And then the actions are really, how am I living this out, growing my cultural intelligence one person at a time? Am I really interested, listening deeply to people's stories? Am I taking the time to really get to know what somebody who's had a different experience from me has been? I had one of those opportunities this morning. I'm preparing somebody to speak for a session on CQ strategy, and this person was telling me she's a Caucasian woman married to an African American man, and just the duality of her life. When she's at work, she's treated like a Caucasian, but when she's at home and in places with her family, she feels like she's treated in a pretty different way. And it was fascinating to hear her story and to hear that she is proof positive that there are disparities in how white people and black people in our society are treated. And one of the things that, she really wanted to convey is she has taken that on as a way to educate and a way to share with people that the experiences of her life have helped her to be highly culturally intelligent, and she uses that not to be upset, not to place blame, but to educate. And I thought, what a wonderful example of somebody on their journey to become more culturally intelligent. And so CQ Action is all about what we do one-to-one. We encourage you to think about those 4 questions and where are you? How might you navigate from here? So when we think about culturally intelligent healthcare leaders, we think about low, moderate, and high cultural intelligence. And what are those signals and symptoms we tend to see? So as we think about low, we tend to ignore those things and think they're irrelevant if we're not really buying into this understanding that there are, in fact, cultural differences that we're experiencing. Similarly to how we all, as adults, have ignored symptoms of something that starts out small and it gets bigger and bigger as we ignore it. So whether it's that little growth that you need to go get checked out from the doctor, that is it sun damage or is it skin cancer, those ideas around what we ignore tends to grow, not get smaller and diminish. Moderate are some cultural norms we understand, we accommodate some things in our thinking and behavior, we're motivated to learn more consistently, focus primarily on what people have in common though. So that is, if we're at that place on our journey, then the very next step for us is to adapt and adjust our thinking, our mindsets, as well as our behavior as we think about those cultural norms, think about creating and drawing upon those differences to leverage teamwork, to really invite people in, embrace them, engage them, include them, have them belong, so that we can really get optimal value of all of our staff members, leaders, and have our patients, most importantly, have a more inclusive and connected experience in our health system. So as we think along that pathway, hope it's helpful to you to think about, gosh, in general, where is our leadership? Where would I put us on that continuum? As we think about the research validity behind this CQ model and cultural intelligence, 100,000 responses, now active for more than 15 years in 100 countries. As I mentioned, A-level academic journals, now more than 1,000 certified professionals, doing work in many health systems, Harvard, University of Michigan, work that is vital and important on this journey. So before we get to having you assess where you are on the cultural learning pathway, thought we would share a video with you that demonstrates opportunity for a little humor.
Hi there.
Hi.
Nice day, huh?
Yeah, finally, right?
Where are you from? Your English is perfect.
San Diego. We speak English there.
Oh, no. Where are you from?
Well, I was born in Orange County, but I never actually lived there.
I mean before that.
Before I was born.
Yeah, like, where are your people from?
Well, my great-grandma was from Seoul.
Korean. I knew it. I was like, she's either Japanese or Korean, but I was leaning more towards Korean.
Amazing.
Yeah, Hamshasina. There's a really good teriyaki barbecue place near my apartment. So I actually really like kimchi.
Cool. What about you? Where are you from?
San Francisco.
But where are you from?
Oh, I'm just American.
Really? You're Native American?
No, just regular American. Oh, well, I guess my grandparents are from England.
Oh, well. Hello, Governor! What's all this then? Top of the morning to you. Let's go sporty! Double, toil and trouble! Mind the gap! Beware Jack the Ripper! Bloody hell! Pip pip! Cheerio! I think your people's fish and chips are amazing.
You're weird.
Really? I'm weird? Must be a Korean thing.
So I wish I could see your reaction, but because I can't, I'll share with you the reaction I tend to see. The reaction I tend to see is people are stunned into laughing, and it's hard to imagine somebody that is that culturally incompetent. But it does remind us that, oh my, this is a journey, and where we are in our healthcare system and moving that needle toward cultural intelligence is vital to our future. As I said before, 50% plus of our population is going to be diverse here before much longer. And that's rapidly occurring, and our opportunity is to keep pace with that. So let's talk about then the cultural intelligence learning pathway. So we go from that unconscious, incompetent place at the beginning of the pathway to know it's not a concern or an issue or a problem for us, to we're aware that there's a need, and now we're ready to commit leadership, resources, and people that really want to model the way. And then we get to that understanding of consciously being incompetent and building awareness. Many of you have been doing that in your health systems for years. Building awareness around unconscious bias, awareness around the need to be more inclusive, awareness around diversity, around practices that enhance your diversity as a health system. Where we want to gravitate to next, and where most health systems indicate they are, is somewhere around building awareness, is toward that conscious competence, that skill development. Because now we know, just like emotional intelligence, cultural intelligence is a developable skill set. It is something that understanding a development framework helps us to really master over time. And so then we get to that inclusive, innovative culture place that really then fosters the kind of teamwork, collaboration, connected, inclusive patient experience, and innovation we're looking for in health systems. So when we think about the cultural intelligence, the big differentiators is what kinds of things are going on in health systems that are to leverage this learning and this work. So first off, embracing a comprehensive cultural intelligence framework, having a culture inclusive definition for your healthcare system, having an understanding of drive, knowledge, strategy, action, our own definition as a health system, what we mean by that. Using world-class evidence-based assessments, getting that vital baseline, and then creating the curriculum for leadership, staff, to first create awareness and then take the deeper journey around cultural intelligence. Thinking about shifting vitally the cultural intelligence mindsets with vital tool sets to get to new skill sets. We think about that measuring that progress at all levels and doing more than just concept and awareness. We've had years of that in most organizations, and this is taking it to strategy and action. In the healthcare systems we serve, those healthcare systems end with a focused action plan for the path ahead. And when we think about how vital that is to your journey, those are the things that we want to encourage. Whatever framework you choose, just that you're thinking about this systemically. So just a last couple of thoughts on the road ahead as we conclude and welcome some questions. One thought is really great to have one cohesive steering committee. What we see in a lot of health systems is there are many task force committees, groups that are connected only in the purpose that they serve. And so really aligning all of that with that steering committee oversight, very helpful to look at what are all the activities we have going on and how can we create more impact by making those into and forming that into a steering committee that has that leadership guidance. How can we partner in the design of an approach that truly is about systemic change, leveraging all the great things you're doing already, inviting in those leaders who are already committed, the task force, the committees, and really embracing a development framework that systemically helps the organization to go forward, and then seeking the support and recommendations along the way. And so the key to this approach and the key that we want you to take with you is the greatest journey with cultural intelligence is that journey within. And the degree to which we get comfortable sharing our own story and knowing our own story helps us to embrace the story of others. And so we invite you, to think deeply about your story and think about that path forward is to share those stories and to listen deeply so that we're able to be even more connected and inclusive.
Thank you so much, Diane. For everyone joining us, be sure to connect with us on the internet at lei-consulting.com. You can also follow us on LinkedIn at Leadership Acceleration and Twitter at LEI_consulting. And now we invite you to join us for a Q&A session. Please click the link in the session information or type in the link below in your address bar on your browser.